Hello, everyone. Today we're here with Dr. Andrew Alexis, who spoke at the Racial Disparities in Dermatology Live Derm Deep Dive. Thank you so much for joining us, Dr. Alexis. Can you highlight some of the systemic issues that contribute to a lack of knowledge about atopic dermatitis and psoriasis and other skin conditions in patients of color?
Certainly, it's a pleasure to be here. Thank you for having me. When it comes to our knowledge of dermatologic conditions in the very broad and diverse range of populations that would be self-described as non-white racial ethnic groups or belonging to the Fitzpatrick skin types 4, 5, and 6, we have a general, just as an overarching statement, we have a general lack of data in comparison to what we know about populations of European ancestry with lighter skin types. And so when it comes to atopic dermatitis, psoriasis, other common dermatologic disorders that can affect any population, when it comes to trying to break down any differences in safety and efficacy of specific treatments or differences in clinical presentation or sequelae, quality of life impact of disease, our data are, by comparison, lacking. And so many efforts are underway to help address this gap. I think your question relates to why this is, and as there's no easy answer. There are a lot of different factors. They include some cultural, socioeconomic barriers to enrollment in clinical trials. Also, I think that the distribution of clinical trial centers, there could be further thought given to where studies are done to ensure that sites that can enroll very diverse representative patient populations are also included in the larger pool of clinical trial sites. I think increased education in communities of color about the potential benefits of participating in clinical trials and what they bring for the future of understanding conditions and future treatments, I think can go a long way as well to improving enrollment. And I think lastly, another thing that can help address knowledge gaps, and there's a trend towards this already, and that's real world evidence. So studies that are done post-marketing and that include generally larger sample sizes, are more pragmatic and can enroll more diverse patients at the community level. So I think all of these efforts will lead to improvements, but we still have a ways to go.
Thank you for that. Dr. Alexis, can you explain why certain skin conditions, including atopic dermatitis and psoriasis, may be more difficult to diagnose in patients with skin of color?
Certainly. So the ability to accurately diagnose and assess the severity of inflammatory conditions of the skin, such as psoriasis and atopic dermatitis, is at least in part based on one's ability to perceive erythema or inflammation, a marker of inflammation in the skin. And so there is a great deal of variability in the healthcare community as far as one's comfort level or expertise or experience in assessing erythema in the context of richly pigmented skin. So redness or erythema in darker skin types can be masked or can be altered. The appearance of the redness may look different shades, purplish, gray, brown. And so the eye needs to be trained to detect this broader range of presentations of erythema in order to be able to accurately diagnose and assess inflammatory conditions like atopic dermatitis and psoriasis. And so the thing is, it depends on one's experience and exposure, and this varies according to where one practices or where one trains. And so there are disparities in comfort level in diagnosing or accurately assessing these conditions. And so efforts are underway to address these gaps with better or more inclusive, more robust educational materials that include a broader representation of how inflammatory conditions present across the spectrum of skin types.
And Dr. Alexis, what is your personal approach to treating atopic dermatitis patients with skin of color?
Yeah, thank you for that question. When it comes to my approach to treating atopic dermatitis in patients with skin of color, in some ways, my approach is very similar to how I would approach atopic dermatitis in any other type of patient. However, here's where the nuances are. We know that in addition to the classical signs of and symptoms of atopic dermatitis that would affect any patient, we know that in patients with richly pigmented skin or skin of color, there is also the additional burden of pigmentary sequelae. So once a inflamed, scaly, itchy plaque of atopic dermatitis resolves, we know that there's a high probability that it will leave behind some areas of hypopigmentation or hyperpigmentation, which would persist for weeks to months, long after the active lesion has resolved. And this contributes greatly to the patient's quality of life and the overall impact of atopic dermatitis on that patient. So with that in mind, I sort of make extra effort to ensure that the atopic dermatitis is controlled, not just in the short term, but continuously, longitudinal control to minimize the frequency and severity of flares, which would generate more pigmentary sequelae. In addition, I will counsel the patient on the tendency towards these pigmentary sequelae and give them realistic timelines as to when to expect clearance of the active lesion, as it were, and when to expect clearance of the potential pigmentary sequelae. And finally, once the atopic dermatitis in any given area is completely controlled with no evidence of active inflammation, I will also incorporate adjunctively topical skin lightening creams when warranted to speed up the resolution of hyperpigmentation. So that would be a nuance when treating skin of color.
That's wonderful. And in what ways do you feel that dermatologists can continue to improve in caring for these patients with skin of color?
I think one way that we can improve the care of patients with skin of color who suffer from atopic dermatitis or psoriasis and other inflammatory disorders of the skin is to be able to better understand the unique manifestations of these disorders in the context of richly pigmented skin, including the pigmentary sequelae, and be able to counsel our patients in a culturally competent manner and to ensure that our treatment goals are aligned with the patient treatment goals. Also leveraging educational materials that exist and that are also being developed to better diagnose, more accurately assess the severity of atopic dermatitis, for example, in skin of color, because under assessment of the severity can have implications on treatment selection and then therefore the overall control of the disorder for that patient. So it starts with accurate diagnosis and assessment, which then leads into optimal treatment treatment options. So the better we can assess the subtleties of erythema in darkly pigmented skin and other manifestations, other morphologies of atopic dermatitis in non-white racial ethnic groups, the better we're able to do that, the better we are able to select the most efficacious therapies for those patients, and the better that they will do over time with better outcomes and less pigmentary sequelae and other sequelae.
Thank you. And Dr. Alexis, is there anything else you'd like to add before we conclude the interview?
No, just thank you for the opportunity to speak with you today, and also appreciate being a speaker at your wonderful conference.
Thank you so much for your time. We appreciate it.
Thank you.